Good evening, Mary Gearin with ABC News. The first full day of the new lockdown has been marked by a continuing steep rise in coronavirus numbers, hardened borders around Melbourne and the state, and some limited relief for thousands of people who've been locked inside their public housing blocks for days. First to today's figures. The state saw 165 new cases overnight. That means a total of 932 active cases now. 40 infected people are in hospital, 9 in intensive care. Worryingly, new cases have also been confirmed among staff of 3 Melbourne hospitals and 6 aged care homes. And so far, 158 cases have been revealed in Melbourne's public housing towers that had been put under hard lockdown. But the testing blitz has shown 2 of the 9 towers are COVID-free. Residents there and those testing negative in 6 other towers can enjoy more freedom from midnight tonight. But hundreds of residents in one tower will be forced to stay inside for at least another 9 days to come.
The assumption has got to be that everybody in that tower is a close contact of someone who is positive. On that basis, just like every other Victorian, they will need to remain in their flat, in their unit, except for medical care and for supervised daily exercise.
The Premier speaking today. Let's go now to Ben Knight, who's outside the residential blocks in Flemington. Ben, what more can you tell us about the residents there?
Well, this tower behind me, Mary, is the one that is going to remain essentially under quarantine, where 53 people have tested positive. The assumption is that 20 to 25% of the people who live in this tower have or will end up contracting COVID-19, and so therefore everybody who lives in this block is regarded as being a potential close contact. But I just want to show you something. If we swing the camera around this way, there is another tower right next door. It's literally only about 50 metres away. This is one of the towers that has 0 cases, one of the 2 towers that have 0 cases. It seems quite remarkable, but there it is. So as we just heard, as of midnight tonight, the people who live here will be on the same restrictions as everybody else in metropolitan Melbourne, while the people who live here will be under quarantine, only allowed out for very limited exercise. And it's worth noting that some of the people who live in this block might be feeling pretty good about being able to get out and about a little bit more, but some of them have elderly relatives who live in this one, so it's still a very strange situation. But certainly those people we've spoken to today who are going to have their restrictions lifted, we're pretty happy about it.
I just want to get fresh air. I just want to walk around on the grasses, and you never see this smile for a long time. I'm just so happy.
A lot of people are thinking, where to now, to be honest with you, or even if we are going to stay in these buildings, it's about advocating to have better public housing policies in place and to ensure that these towers are looked after, not only for us, the people who are here now, but for generations to come.
So there are 6 other towers which do have cases, but they're low numbers of cases. So they'll be on what's called strict monitoring. The restrictions will be lifted, but people in those towers who have the virus or their close contacts are going to be pretty strongly encouraged to put themselves elsewhere. Now that's difficult, of course, because we are talking about public housing blocks. But what's going to happen in those towers is there will be door knocks tomorrow. People who have the virus will be, quote, strongly encouraged to take up the offer of hotel quarantine. But the question is still out there. So are these safe places to live even now? Well, that depends on what happens next.
The good news also is the other towers that we're now moving to stage 3 type restrictions are having some of the things that the tenants themselves have identified as shortcomings in those high density living areas, particularly the deep cleaning and the frequently used contact surface cleaning.
And so Melbourne returns to lockdown, but it seems that staying home is a bit harder this time around than it was the first time. Let's hear now from Norman Hamont.
In Melbourne's famous laneways, there was no morning rush. A CBD that had been slowly re-emerging, now back in lockdown, with a warning that businesses like cafes that barely survived the first version might not make it this time.
The CBD, I know itself, has been ripped at the seams. We're the heartbeat of Greater Victoria, so the engine room's down.
For more than 5 million people, this is the new reality. Checkpoints on major roads and freeways leading out of the city.
Since we had restricted postcodes, most people have been doing the right thing, and so I think they are taking this seriously, as they need to.
But some parts of the city didn't look like they were under lockdown at all. Premier Daniel Andrews said if that behaviour continues, this lockdown could be extended.
If we don't drive these numbers down, then 6 weeks can become longer.
Of Victoria's 932 active cases, the hotspots are still in Melbourne's north and west. But despite being outside the lockdown zone, Geelong currently has 6 active cases. There are 4 at Bendigo and 1 each for the Surf Coast, East Gippsland, Shepparton and Wodonga. The Mornington Peninsula, under the stay-at-home orders, has none. The Mornington Peninsula is included in the Greater Melbourne lockdown. There are no checkpoints to pass through, and the local council says that's a problem. The council wants the state government to issue clear rules that people must limit exercise, golf and swimming to their own local areas.
We're just really worried over the next 6 weeks we could be dealing with a constant flow of people who want to be coming down here for a day trip and really bringing what is a higher risk and a higher situation up in the city down to our area.
Here, tensions are already starting to fray. It seems many people aren't staying home like they were the last time, even if driving Victoria's COVID numbers down depends on it. Norman Hermont, ABC News, Melbourne.
And Ben Knight is still standing by in North Melbourne. Ben, what more did we learn today about Victoria's new cases?
Well, Victoria has a new biggest outbreak. It's the Al Taqwa College, and the ABC has confirmed that some children who live in these public housing towers did attend that college. But let's now take a look at the numbers, and we'll start with the Al Taqwa College because there are another 6 cases there, which brings the total to 113. There is another case at the catch.com.au distribution centre, which is also at Truganina. So that takes the total there to 4. There is another case that's linked to the Hugo Boss store in Collins Street, taking that cluster to 8. Meanwhile, to the health sector, there are 2 healthcare workers at Royal Melbourne Hospital and another 2 from Sunshine Hospital Emergency Department that have tested positive. And there's 1 new case that's been found in a staff member at the Northern Hospital in Epping, so that takes the total to 11. And in aged care, 6 aged care homes are in lockdown. They're at Essendon, Altona Meadows, Ivanhoe, Doncaster and Healesville. All the staff there have tested positive. But from here in North Melbourne and also in Kensington at 11:59, the restrictions will be lifted. We'll probably see some people outside tonight.
Ben Knight, thank you very much, standing by in North Melbourne. Well, the New South Wales Premier says that state is on high alert as the Victorian surge continues. New South Wales has recorded 11 new cases in quarantine hotels and confirmed the 2 previous probable cases in Albury. Gladys Berejiklian has repeated her plea for people in border towns to not travel. And as Jessie Dorset reports from Albury, that hasn't gone down well.
Setting up and settling in for the long haul.
You'd have to say that the Victorian lockdown looks like it will be a minimum of 6 weeks, so I imagine that we'll be staying the course for at least that.
Authorities have opened more options for residents to cross from Wodonga to Albury. After long lines yesterday, this morning's commute was much faster. And for those guarding the checkpoints, warmer.
We've sent down 2,000 pieces of warm underclothing and we've got hats and beanies. The officers are being given those.
And a helping hand, in fact hundreds of them. As more troops arrived on the ground, the Premier doubled down on her warning.
Please do not go outside your border community unless you absolutely have to. And similarly, if you're a resident of New South Wales and you've got family or business activity down there, please don't go down there unless it's absolutely essential.
That's not gone down well with some in the smaller town of How Long.
Regional areas are not really the problem. It's the capital cities.
Where she lives, Sydney or something, she's probably got it real good. She gets to live her normal life, but we don't.
They'll sort it out sooner or later, so we just have to put up with it.
Catherine Fife and her family are doing just that. They bought the local bakery 2 months ago, just as some businesses were being ordered to close.
It's a terrifying time, and I think we're going to experience further lockdowns, and I think we're going to experience a decline in business over the next month or so.
Like many others around here, she's stoic.
We have to do what we have to do to protect ourselves, to protect our community, and we have to do what we have to do to slow the spread of COVID-19.
What were you thinking?
34-year-old Victorian man, Jared Searby, has been released on bail after allegedly attempting to cross the border without a valid reason. The Albury court heard the father of three told police COVID-19 was fake and the border legislation unlawful when he was stopped at Corowa yesterday. He's now been given a permit so he can come into New South Wales if it's essential. Jessie Dorset, ABC News, Albury.
And reporter Jessie Dorset is back at the Albury checkpoint for us. Jessie, today seemed to go much more smoothly.
Mary, considering that 125,000 permits have been issued in less than 72 hours, it's remarkable how well the operation is now working. A big improvement on yesterday. The bigger checkpoints are busy at times, a lot of people returning home from work now, but the traffic is moving. About a dozen cars have been turned back to Victoria because police didn't believe they needed to cross the border. The infrastructure's in place, the locals know what to expect, and the authorities are well practised in the process. So this is just part of life now, for a while at least. Mary?
Indeed. Thank you very much, Jessie Dorset. Two other states have today tightened their rules to further restrict arrivals from Victoria, WA and Queensland. Only highly restricted categories of travellers from Victoria will be allowed into WA and will have to self-isolate for 2 weeks. And from midday tomorrow, Queensland will turn away any residents not from that state who've been in Victoria during the past 2 weeks. Here's Stephanie Zillman.
On the Queensland-New South Wales border, anticipation and concerns are building ahead of tomorrow's reopening.
We had to turn around and get a border pass to come back from New South Wales to Queensland just to do a U-turn.
I understand why it's in place, but it is very frustrating for the locals here because essentially the border runs through our town.
As southern holidaymakers prepare to enjoy the Sunshine State, restrictions are being tightened for one group of would-be travellers. Victorians will be totally banned from tomorrow, with the option of self-funded hotel quarantine taken off the table. The turnaround policy will apply to any non-Queensland resident who has been in Victoria in the past 14 days.
We need to reserve hotel accommodation for people who need to be quarantined, Queenslanders and Australians returning from overseas, Queenslanders returning from Victoria.
Exemptions will be very limited and will only be considered for those essential health workers, freight operators including trucks, and people travelling on compassionate or hardship grounds. Compassionate grounds won't extend to funerals. This exemption will mainly apply to those visiting dying relatives, but they'll still need to hotel quarantine first.
If the hospital or the palliative care service is able to supervise the interaction and provide PPE, then that person can visit their dying relative.
With hundreds of thousands of visitors already registering for a new border pass, police are warning the queue to enter Queensland will likely be a long and painful one.
We can only process so many vehicles and so many people at any given time.
Already, 238,000 people have applied for border passes, and each pass is only valid for 7 days.
That indicates to us that over 238,000 people are intending to come to Queensland in the next week. That is a lot of people. So that will mean that we'll see congestion and delays.
Under the updated rules, anyone who does enter Queensland will be subject to mandatory COVID-19 testing if they develop symptoms of the illness, and people who do not get tested may be slapped with a $4,000 fine. While Queensland has continued its streak of no new locally acquired cases of coronavirus, health authorities have a strong message to the community. That success will only be maintained if the high rate of testing continues. Stephanie Zillman, ABC News, Brisbane.
The United States has now recorded more than 3 million cases, cementing its unwelcome position as the worst affected country in the world. The US death toll has passed 132,000 and this week recorded 60,000 cases in one day. Donald Trump has come under fire from his presidential rival for mishandling the crisis.
Columbia School, medical school, saying that there'd be, if he had acted several months earlier, just 1 week earlier, there'd be 36,000, I think it was, fewer people dead. He's not changed anything. This pandemic is still raging.
Despite the growing numbers, the White House wants to press ahead with school reopenings. Vice President Mike Pence says cases are flattening out and that restrictions to combat the virus should not be too tough.